Hi Shawntel, I'm so glad that you were able to take time to come in to talk about laser hair removal today.
I know I've been wanting to do this for a while, and you know, with my busy schedule it gets crazy sometimes, but I finally got a chance to come in. I'm looking forward to it, but I have a lot of questions.
Well, that's okay. Hopefully I can answer all of them. Now I know you've been wanting to treat your underarms, is that right?
Yes, I thought I can go start with that. And my first question is, I'm sure everyone asks this, but how bad does it hurt?
Oh, that's a great question. It's a little bit uncomfortable, but honestly, most of my clients tolerate the treatment really well every day. If it's something that you're worried about, I do have some lidocaine cream that I can give you. You just put it on about an hour before treatment, and it will help decrease the sensitivity. I also can use ice packs either before or during the treatment to help decrease sensitivity.
And before I come in, is there anything I need to do beforehand, like shave or not shave for a week or so, which I hope that's not the answer?
That's not the answer, and great question again. You know, the great thing about laser hair removal, Shawntel, is you never need to let the hair grow out, unlike waxing, which of course you do. So with laser hair removal, you can shave right before you come in. You just need to make sure there's a bit of hair that's left underneath the layer of the skin. So what I mean is, you need to not wax, don't pluck, don't bleach, or use any sort of depilatory cream. You know, the treatment also works best on fair-colored skin, so the lighter you can keep your skin by using a good quality sunscreen, the more effective it will be for you.
Okay, and then because speaking of when I shave or when I wax, I sometimes get my skin gets really irritated and I have bumps. So will I have that doing laser hair removal?
You know, for razor burn and ingrowns, laser hair removal is a great long-term solution. However, after each treatment, you'll notice that your skin will look pink. It might feel like you have a mild sunburn, and you will probably notice some little bumps around your hair follicles. These are all perfectly normal reactions, and they can last anywhere from a few minutes to several hours, depending on how reactive your body is. Every once in a while, I have a patient tell me that their skin becomes a little bit itchy after treatment, and if this happens to you, I'd recommend just using an over-the-counter hydrocortisone cream, something like Cordaid. And rarely I have a patient that tells me they've developed a little pimple-like bump in the area. This is usually because a hair becomes trapped in the layers of the skin and hasn't shed as it should. If this happens to you, I'd recommend just using a polysporin ointment twice a day for the first 3 days.
And how many treatments does it take to actually, and does the hair really go all, gone forever?
Right, great questions again. Well, you know, in terms of how many treatments it will take for you, Shawntel, it varies person to person. In general, most people find they need 8 to 10 treatments, although you should start to notice thinning hair after the first treatment. And does it stay gone forever? Well, let me explain that one. Yes. However, so the laser is attracted to pigment, and so it's only effective on hair follicles that are actively growing a hair. Believe it or not, we're all born with millions of hair follicles, but they're not all growing hairs. It takes a big hormonal shift to trigger the hair follicle to activate it and start hair production. So all of us go through a big hormonal shift in puberty, which activates many hair follicles, but there are other shifts that can happen as well, such as pregnancy and menopause. In fact, it's very normal as we age for additional hair follicles to become active and start producing hairs. So although absolutely I can get rid of almost all of the hair that you have growing now, I can't promise you that you won't have additional hairs that start to grow in the future.
I feel like I've learned a lot. My last question is this, coming in here today, how long is it going to take? Like an hour, a couple minutes to do my underarms?
Right, and I know that you have such a busy schedule. Well, depending on the body part that you want to treat, treatments can take anywhere from 5 minutes to 2 hours. I can tell you that laser hair removal on your underarms only takes about 15 minutes for the whole treatment. So it should be something that you can do easily on your lunch hour.
Oh, nice. Well, I'm ready to do this. You've talked me into it.
Fantastic. Well, I just have a couple little pieces of paper that I'm going to have you take a look and sign, and then I'll go ahead and get the treatment room ready for us.
Great, thank you.
Shawntel, I have the room all ready for you. If you'd like to come in and put on the spa drape, I'll give you just a few moments of privacy and I'll be right in. How are you doing, Shawntel?
A little nervous, but I'm ready.
Well, fantastic. It's all going to be over in just a few minutes, and I think you're going to be surprised how easy it is. So the first thing I'm going to do is have you raise your right arm over your head. Great. So what I'm doing is just prepping the skin before we treat it. I'm just taking off any deodorant or body lotion, any perfumes that you might have put on earlier in the day. Next, we both need to be wearing safety glasses. So I'll give you a pair, and I've got a matching set.
Nice.
And the last step before treatment, I have some chilled ultrasound gel that I use for conduction. It also helps to keep the surface of your skin very cool during treatment. So I'm going to go ahead and apply that now. So I have the laser set at a setting that I think is going to be appropriate for your skin type and hair type. And of course, I'm going to be looking during the treatment to see how your skin responds to the machine. It's just as important to me how you're feeling the treatment's going. I like to tell my patients on a 0 to 10 scale, 0 being no pain and 10 being the worst you can imagine, this treatment really shouldn't be higher than a 2. So what I'm going to do is grab the handpiece, we'll just do 1 pulse, and you kind of give me an idea of where you're at, all right?
Okay.
Great. Now the next thing you're going to feel is the handpiece touching your skin. It has a cold glass crystal that's going to be touching your skin, and it will feel like an ice cube. You're going to feel that now. And I'm going to give you a 1, 2, 3 count, and you'll feel 1 tiny little pulse. Here we go. 1, 2, 3. How was that?
It didn't feel like anything.
Fantastic.
That's really it?
That's really it. Well, now I'm going to do several pulses in a row, and before you know it, we're going to be all done with this side. Here we go. How are you holding up, Shawntel?
It's not bad at all.
You might start to notice as I get closer to the margin of your breast, there's a big patch of lymph nodes in that area. It won't necessarily be more painful, but you'll notice it will be just kind of a different sensation. That's very normal. We're about halfway done. All right, Shawntel, that side's complete. How are you feeling?
That's not bad at all.
Wonderful. Let me just get you cleaned up. All right, Shawntel, we're ready for the next side. So go ahead and lift up your left arm for me.
It tickles.
I'll bring over a bit of ultrasound gel.
So I have a question. So after today, when is a good time to come back and do the next treatment?
Well, usually we bring patients in every 6 to 8 weeks. So what we'll do when we get out front is look at our scheduler and see if we can't find a space on your calendar sometime within that window.
Okay, perfect.
You're going to feel me touch, and here we go.
So fast.
And believe it or not, that's all there is to it. Let me get you a clean hand towel. I'm sure you're still a bit sticky from all of that gel.
Thank you.
You bet. So I'll give you a little bit of time to get dressed, and I can just meet you out front when you're ready.
Thank you so much.